3 social workers will be recognized for their dedication, innovation and contributions in the social service and healthcare sectors. The Outstanding Social Worker Award will be presented to them in conjunction with World Social Work Day. And for more, we have with us one of the award winners, Genevieve Wong, Head of Medical Social Services at the National Heart Centre, and Tan Sze Wee, President of the Singapore Association of Social Workers. Ms. Wong, Ms. Tan, welcome to the programme.
Thank you, nice.
So, Ms. Wong, let's start with you. First of all, congratulations for winning this award. 25 years as a medical social worker at the National Heart Centre. Share with us your work and your role. How have they changed over the years?
Thank you very much. Okay, so I've been a social worker for 25 years in Heart Centre, and the role has really evolved significantly. So, aligning with Healthier SG, where we aspire for our patients to live comfortably in the home, to live well in the community as long as they can, what we've done was to really focus more on integrated care with the community so that patients can still have what we call a continuity of care from hospital to home. Okay. The second change in terms of our role as social workers, in National Heart Centre, there is a lot of emphasis, on patient empowerment and community support. Okay, so why patient empowerment? Because we have seen a lot of cardiac cases where they have preventable readmissions, and we realized that maybe if we could come up with a patient empowerment model of care to help them reduce their preventable readmissions by helping them take charge of their health, that would at least help them have what we call better health outcomes and better quality of life.
This patient empowerment model that you're talking about is called LACE.
Yes.
Is that the system? Okay. So what inspired you to come up with this model in the first place?
Okay. So two main reasons. There is a growing pressure on the healthcare system owing to the aging population, as well as the increasing prevalence of cardiac disease, and this would put a lot of burden, on the healthcare system. And so, the team of social workers, they knew, that in the long run, this would not be sustainable, and we will have to come up with a more sustainable model of care that enables patients to be empowered to take care of their health so that they can partner us on this care journey to ensure that they take care of their health. And how we do this is, it's very person-centered. So what we do is, we have what we call goal-centric conversations where we get patients to actually set healthcare goals, right? That kind of like are aligned with what's important to them and what matters to them in terms of their life priorities, in terms of their values, and in terms of the good life that they want for themselves. And what we begin to realize is that when patients are able to see that their healthcare goals and their idea of what a good life is, it's aligned, we begin to see patients taking more responsibility over their health because they know that by taking care of my health, I would be able to get the good life that I want.
Okay, that's fantastic work, Ms. Tan. Ms. Wong was talking about aging society there. Based on your experience, what are some of the other key challenges that social workers are facing in this day and age?
Social workers are change agents, and to be effective at that, we need to be operating at multiple levels, the micro level to the macro level. So picture this, social workers are on the ground, diving deeply into the stories of their clients so that they can deliver the right type of help needed. They are also in discussions looking at how to address the systemic issues or barriers that their clients face. Being able to juggle these various responsibilities to multitask, moving from providing client-centric care to addressing more broader systemic challenges or issues is made even more difficult when there is funding limitations or restrictions. I think these challenges are set to increase as the demands on social workers to provide client-centric care increases, and also to address social issues sustainably, just as Genevieve mentioned. This will set to increase and will intensify the workload of social workers. And if the funding and the support systems are not in place, this can diminish the efforts of social workers and lead to them feeling burnt out.
So apart from funding and support, Ms. Tan, how big of an issue is manpower shortage, staff retention in the industry?
We continue to face these challenges while we have young people coming to the profession driven by a passion to make a difference in this sector. The high stress and emotional toll continue to bring about a high staff turnover, and this in turn sets a cycle where our assisting social workers can feel demoralized. I think as a sector, we need to be looking at these challenges head on to put in good governance, solid HR practices, and commit to ongoing professional development that will create an environment where social workers, both new and assisting, can thrive.
Ms. Wong, what do you think from your experience leading a team at the National Heart Centre? Has it been difficult to retain staff?
Okay, so it has been, but what I've also realized is that the key drivers that would actually help retain social workers in the profession are mainly two things. I mean, from my heart centre experience, one is if social workers can continue to experience the meaning and purpose of their work. Okay. Secondly, if they're able to still be able to contribute towards innovation. Because by having that space to be able to innovate care models that can make an impact on patient care, that would in turn, deepen the meaning and purpose of their work, and that would then help, to retain them in the profession.
In relation to this finding purpose, finding meaning in their work, Ms. Tan, this award will be presented on World Social Work Day next year in March. To what extent do you think such awards and recognition will help to motivate our social workers in their line of work?
I think these awards serve a twofold purpose. One, they recognize and celebrate the contributions that the outstanding social workers have made in their particular field of practice. It really celebrates their dedication and professional contributions. But to the rest of us in the sector, I think they inspire us to rethink our practices, to think about ways that we can innovate so that, together we can build a community that is constantly and continuously wanting to improve for the betterment of our society.
Looking ahead, Ms. Wong, what does this award mean to you, and what other contributions do you hope to make to the sector to support the landscape and the people?
Yes, so this award brings attention firstly to the work that social workers do. I want to dedicate this award to the social workers in Heart Centre who have really worked tirelessly, in terms of the commitment and dedication to LACE. So it really brings attention to their work and the impact on patient care. It also brings attention to the work of social workers in different sectors, in the social and health sectors. And that's what it means. It highlights our contribution, to patient care. Secondly, I think in terms of how we hope to contribute more in terms of social and health care, social workers have the expertise in psychosocial care and social and health integration. I think there's a lot that we can do to contribute to capability building in the community, to see how we can continue to innovate models of care that can integrate social and health so as to have better patient outcomes.
You're definitely doing fantastic work. Thank you so much, Ms. Wong, Ms. Tan, for speaking with us tonight on Singapore Tonight. We were speaking there with Genevieve Wong, Outstanding Social Worker Award winner, and Tan Sze Wee, President of Singapore Association of Social Workers.